Okay, so we're ready to go, and I'd like to introduce Abigail Tumpe. She's the director of our communications efforts in the Division of Healthcare Quality Promotion, and she's going to wrap up the session for us with talk with you about keeping the public's trust and how to communicate about your NHSN data and HAI prevention.
Thanks, Teresa. And first of all, let me first say thank you to all of you. I thought for certain that being the last person on a 3-day training right after a 15-minute break, I was going to be talking to a bunch of empty chairs. So I'm so thrilled to see faces. As Teresa mentioned, I'm Associate Director of Communication Science for CDC's Division of Healthcare Quality Promotion. And basically what my team handles, not only do we handle communications around National Healthcare Safety Network and healthcare-associated infections, but we also handle issues including blood organ tissue safety, medication safety, antimicrobial resistance, and vaccine safety for the agency. So we have a very mixed bag of topics that are very difficult to communicate on. And so what I'm going to talk to you in the next couple minutes is how do we communicate on healthcare-associated infections and NHSN data, and do it in a way in which we still keep the public's trust and trust of the media and trust of our policymakers and trust of the people within our community. And so first, let's talk about what is the communication landscape in which we're currently operating in regards to healthcare-associated infections. And let me say that it's actually a very difficult one. In comparison to some other topic areas, this is really one that is very difficult to navigate communication-wise. So first of all, HAIs can generate a significant amount of press. But lately, we've seen a shift from national focus to more regional or local focus. So what does that mean? That means that reporters are more likely to be focusing more so on the facilities within their area. These may be reporters, for example, who've never talked about a healthcare-associated infection. They don't necessarily know what it is. And that means that from a communication perspective, it's going to take us a lot longer to get them up to speed so they can actually write a well-balanced piece. There's a wide and varied audience, so we need to reach a variety of healthcare providers with our messages and a variety of patients with our messages. Our science is very complex, so the topics are really difficult for consumers and media and policymakers to grasp. There's numerous prevention recommendations, so there's not one behavior that could prevent all healthcare-associated infections. And there's a need for strong risk communication, so patients may feel a variety of feelings. Fear, loss of trust, and lack of control are big ones. And so our main objectives in communicating around healthcare-associated infections are to increase patients' and caregivers' awareness, educate providers on best practices, and improve transparency and accountability around reporting of medical errors. And I think if any communications that you all do, if you kind of focus on, these are our three objectives, you're moving in the right direction. So let's first talk about some myths and actions that we can do. So first of all, some myths in regards to communicating on HAIs. So first, there's this myth that telling the public about a risk is more likely to cause undue alarm, when in actuality, talking about it could actually decrease the potential for alarm and giving people a chance to express concerns. There's a myth that we shouldn't go public until we completely have the problem solved, when in fact, if we actually discuss the information about prevention programs early and involve consumers in the process, this is a good thing. So there's a myth that consumer advocates can stir up unwanted concerns. And in actuality, many of these consumer or patient advocates can help focus public attention that can really be helpful for our infection prevention programs. And so we really need to come up with strategies to work with them rather than against them. And I'm going to talk a little bit about how to do that. HAIs are difficult for the public to understand, but so that's really where we need to focus on delivering clear communications. And I think there's this myth that risk communication is not my job. And what I would encourage all of you is, regardless of where you sit in your organization, regardless of your role, I think that you can have an impact in regards to communications and the way your facility, the way your healthcare system, the way even your superiors, the way the communicators, even in your facility, are talking about healthcare associated infections. And so hopefully some of the keys we're going to talk about are going to help you with that. So some people might think that communications is actually kind of like a game of throwing pasta against the wall. You just kind of throw messages out there and you kind of see what sticks. But there's actually some methods to our madness. So a little bit about some best practices that we try to do. We select audiences. So this is called audience segmentation. We learn from audiences and shape our messages for them. So we have formative research and we work with consumers in advance. We use what we know about behavior theory. For example, if you're tackling a behavior that healthcare providers are doing, using observation is one way to look at what are some strategies in order to look at those barriers of overcoming some of those, implementing the recommendations. We use multiple channels to reach out to audiences, and we repeat the message. So we optimize our exposure and frequency of our message, and we build in feedback loops. So what's the audience hearing and how are they responding? And then we change our messages accordingly. So the next couple minutes, I want to talk about maintaining trust with patients, public, policymakers, and media, ensuring accountability, engaging consumers, and enhancing transparency. And that's really, what do you do when things go wrong? Because let's face it, at some point in time, things go wrong, and you're going to have to do patient notifications or talk about a breach of infection control. And that's really a difficult issue to tackle. So let's talk about being accountable. So regardless of where you are from in the country, we all know that there's 28 states in DC that have some sort of mandatory public reporting law. But now because of CMS, because of the changing landscape of HAI public reporting, all of us are going to be impacted by public reporting. So what does that actually mean for a patient? The good news and bad news. So the bad news is we have really limited data on what patients' understanding of public reporting data. The only actually group that I know that has actually tested some of the examples of public reported data that's out there is actually Region 6 of HHS Region 6, which is a group of states, Texas and several states surrounding, that took a variety of examples of public reported data that are currently being used, and they focus group tested in their area. Now, there may be others, and I actually would love to hear that. Unfortunately, we haven't had the ability ourselves to do any additional focus group testing. But the good news that came back from that limited focus group study is that what patients really liked was actually the data that's already currently being used on Hospital Compare. So here's actually 4 of the 6 examples that were tested. One used, at the top here, one used just words. Another used symbols. Another, this looks very similar to probably some of your state public reporting reports in which there's a confidence interval bar. And then the bottom, which is very similar to Hospital Compare, that has data and a bar and information on it as well. So although there were mixed responses on how the data would influence decision making, one of the things that came out of it is that there's really a need for us to better explain what this means. And so what does this mean to you and me when we're releasing information on Hospital Compare, or your state, for example, is releasing data from your facility? What can you as an individual do? I think the best thing is to look for opportunities to release information simultaneously. And that's an opportunity for you to tell your story of what's happening within your facility. Let me give you an example of that. So, for example, when we first had some of the initial data come out on Hospital Compare with some of the CLABSI data, we saw several hospitals across the country took the opportunity to talk about the data that was coming out. Now, there were some hospitals that looked at the data and said, the data's not reliable, the data's not accurate, things like that. There's other hospitals that took a much more positive approach and said, this is the data that's being reported. And it shows that we're doing a really good job in CLABSI prevention. But one area where we can improve is surgical site infections. And let me tell you how we're going to improve that. We're going to do it by XYZ, these prevention collaboratives, and we're going to take what we've learned and we're going to report that back out next year, that sort of thing. And we saw that the media and the reaction from the second example I gave was much more positive, in which the facility was very open, transparent, talked about this is where we're good, this is where we're not so good, this is where we're going to improve, and this is how we're going to do it and how we're going to circle back to you. And so that really comes down to the whole crux of the matter, which is how do you maintain and keep trust? So trust is one of those very difficult issues. Trust actually, if you actually look up trust, there's a variety of scientific publications about how to keep public's trust. And there's something like, I don't know, 16 different definitions of what is trust. But my favorite on this is actually breaks down trust into 4 different concepts. One is empathy and caring. The second is honesty and openness. The third is dedication and commitment. And the fourth is competency and expertise. So let's go back to that example that I just gave you. So using this concept of trying to keep trust with, seen on this chart on here, empathy and caring being such a big factor. So let's go back to the scenario of that hospital 2 that was releasing information about CLABSIs and SSIs. What they could potentially say is, we know that patients are impacted by healthcare-associated infections, and we want patients who come to our facility to be safe. And we know that we're doing a really good job in CLABSIs, but we need to improve in surgical site infections, and this is what we're going to do on that, because we are dedicated to ensuring that the patients who come to our facility receive safe care. And let's talk into more detail about some of the prevention activities that we're going to do in that area. So you see in that example, I used empathy, openness, dedication, and competency. And that's a way of really ensuring that you're being open and transparent and honest and really focusing on how do you keep the public's trust in the process. So just going to this in more detail, 7 rules kind of for maintaining trust. The first being is stop digging. And I like this concept because basically what's the first thing you should do when you're stuck in a hole is stop digging. So being overconfident or over-reassuring on any situation really kind of makes that credibility hole deeper. And so you don't want to keep digging. You need to really acknowledge the situation. And so one of the things that we see is that if people don't acknowledge the situation that they're in, external people, patients, patient advocates, media, policymakers will actually think that you're not aware. And so rumors will start. So in fact, you actually need to acknowledge the areas of improvement. You need to empathize and even apologize. So don't let your efforts to prevent your acknowledging the tragedy of illness, injury, or death. Listen to and legitimize the public's concern. Your goal is to produce an informed in public and not to diffuse public concerns or replace actions. And ensure transparency, so be honest, frank, and open. Set up accountability mechanisms. So I mentioned before the example of that hospital 2. Talk about ways in which you're going to come back and report out information. So if information is coming out, for example, quarterly on Hospital Compare, then maybe that's an opportunity for your facility to put a web posting on your website or a blog on your website that says, this is what our facility is doing in regards to preventing healthcare-associated infections, and give yourself an opportunity for you to tell your own story. And lastly, forecast emerging problems on the horizon. So this could be things like emerging pathogens, drug-resistant issues. areas where, for example, maybe you're starting new tracking in other parts of your facility or other infections. So you may start picking up other infections and reporting those out. So forecast what's on the horizon. And what you personally can do. So always do your homework. So I mentioned this before, but in advance of a data release, pull your infection data, brief the individuals that are up the chain from you so there's no surprises. Assess who else you need to communicate with in the state. This could be like the state health department or the state public information officer. For example, if you happen to be in a state that has a public reporting law, that's a great opportunity right before your state health department puts out their public reporting report for you to contact the state health department, find out what they're going to say about your facility so that you can be on the same page and be saying the exact same thing as the state health department. Develop a communication strategy, engage consumers in advance, and we're going to talk about that next. So dialogue as much as possible, be transparent, and remember that messages must address emotional responses as well. So you expect a variety of emotional and practical responses from consumers. So going back to that picture of the trust, remember, empathy, caring, honesty, openness, and dedication are key. So I'm not going to talk through these in detail because you have them in your packets, but this is a great little do's and don'ts of communicating pitfalls. And there's actually 2 slides on this. So this is a great kind of walk-away item of things to do. This is great to look at in advance of media briefings or talking even with patients, but great key points to remember moving forward. I want to move on and talk about engaging consumers. And this is actually something that CDC has done a fair amount of work in. Let me start, first of all, and talk a little bit about why I think it's a good idea to engage consumers. So first of all, I think external viewpoint is always beneficial. So getting feedback on messages and your communication efforts really helps you focus. It really helps you, make sure, are you going in the right direction? Are you really looking at all of the various aspects? And cooperation really increases credibility. So to the extent possible, involve consumers in the decision-making process. And so make sure that if you do involve them, let them know how you're going to work with them. And remember, at the end of the day, we all want the same thing, which is patients to be safe. So CDC actually started working with patient advocates about 5 or 6 years ago. We actually first started by including a patient advocate on our Healthcare Associated Infection Advisory Committee, or HICPAC. So a liaison from Consumers Union, Lisa McGiffert, was actually put on that advisory committee. But shortly after I came to the division about 4 years ago, I started these regular conference calls with patient advocates. And to be honest, this was one of the first times, and we were one of the first groups at CDC to really pick up the phone and talk to individuals who had either been lost loved ones themselves. Many of them had lost children to healthcare-associated infections. Some of them had lost parents or spouses. Some of them have had infections themselves. And so you can imagine that the opportunity for them to speak for the very first time to CDC, they certainly had a lot of things to tell us, a lot of things where they really wanted to let us know different directions we probably should be going. But we really found over time that this was a great opportunity for us to really hear and get feedback and make sure that in regards to our communications that we were going in the right direction. So 2 years ago, and then actually just this last week, we held a conversation with consumers here at CDC. And so this is actually a picture of a variety of consumer advocates from across the country that came to our first consumer meeting in June 2010. And then, like I said, we just repeated this last week with 16 patient advocates from across the country. And so after the first meeting, some of the responses, I'm going to read to you a couple of these. So this is actually from the Consumers Union blog. It actually, some of the quotes from the advocates said, "Never in my wildest dreams did I expect to be sitting in a conference room having a conversation with top-ranking CDC physicians and others. The CDC is becoming more consumer-friendly. It was wonderful to hear CDC officials say elimination is their goal. And CDC and the activists intend this hospital infection conversation to be ongoing in order to support CDC's efforts in infection prevention and for the CDC to incorporate consumer perspectives moving forward." So this was actually a group that prior to coming to CDC and prior to having a sit-down conversation with us were actually really very negative about the direction that we were going. They were, rightfully so, had concerns about what was happening really on a national stage regarding healthcare-associated infections. And I think once we sat down and really had conversations with them, we started to realize that for the most part, we were very much in agreement, and they started to better understand that we were really working in the very same direction. We may come at it from different angles, but we're working at it in a different direction. Now, many of the individuals that we've been talking with are probably in your communities. And so, these are individuals who may, for example, sit on your HAI advisory board in your state. They may write a lot to your local paper. They may be people who are lobbying in your state in regards to state legislation. They may be putting out, blogs or social media or things like that in regards to this topic area. These are great individuals to contact and get to know and let them know what you're doing in regards to prevention activities in regards to preventing healthcare-associated infections. And because I think once you really sit down and have the conversation, you'll start realizing that you're all working towards the same direction. So how do you do it? Start local. Look for an advocate who's outside your healthcare system but maybe in the vicinity. So groups you could tap for assistance if you don't happen to know someone, Consumers Union or even your state HAI advisory board, because most of them have a patient advocate. And maybe start with an initial face-to-face conversation. Schedule monthly conference calls after that, or periodic face-to-face, maybe on a quarterly basis. And items to discuss would be things like progress on your prevention collaboratives, new initiatives, communicating with patients in the community and how you get feedback on how you could do that better, and then public reporting of infection data. So next I want to talk a little bit about how to enhance transparency. And fortunately, I love this picture. It's quite moving. It actually really summarizes, I think, what patients are feeling in many of the circumstances that we deal with. But this particular picture was actually the front of the Denver Post right after there was a large patient notification event in which there was a scrub tech at a large hospital in Denver that was actually diverting pre-filled syringes of narcotics, and there was thousands of patients that had to be notified of getting testing. And the Denver Post then followed up with many of these patients and started putting patient stories all over the front page. And this was the particular one that was released the following week, when all of the patients at this point, a good portion of them had come in, they had received testing, and they were sitting there waiting for to get those results, and that concept of really living in fear. And I think in many of the incidences that we deal with, many of the outbreaks or some of the infection control breaches, and where they get that very scary patient notification letter, this is the feeling that patients are feeling, this feeling of overwhelming fear. And so what are the factors that are really causing that? So it really comes down to risk perception. And so there's several key factors that really impact our perception of risk. So here's two kind of columns. On the left-hand side are factors that are more accepted risks. Those are perceived to be voluntary, under an individual's control, have clear benefits, be natural, be generated by a trusted source, be familiar, or affect adults. And those that are less accepted are those perceived to be imposed, controlled by others, have little or no benefit, be man-made, be generated by an untrusted source, be exotic, or affect children. So when you think about medical errors and healthcare-associated infections, they really kind of sit in that right-hand column of being impacted by, controlled by others, be man-made, be generated by a source maybe that may be untrusted, be exotic, be imposed. And so, so when you think about, risk perception, this is really kind of hones in on what are those factors that are impacting that. And so whenever we communicate around these issues, we really need to make sure that we have very clear risk communications. So one of the things that we were particularly seeing in regards to patient notification events was the need to help facilities. So you have, for example, an infection control breach, and so what do you do? How do you get information out? And we've been working with a variety of healthcare facilities and states on their patient notification events. And what we started to see is some true best practices that were coming out of them. So we actually took some of the best materials that we've seen. We actually put them through focus group test. And we tested some of the best letters, some of the best press releases and things like that. And we've put them together in a patient notification toolkit. And so this patient notification toolkit's in the final stages, but it's going to have in there example letters let's say you have an infection control breach and you need to notify patients. This is going to give you a sample mock letter that has been tested by patients that allows you to literally go in, type in your healthcare facility, type in your personal information, and it has all of that risk communication language that is really appreciated by patients. It has information in there like planning for media. And then, for example, I gave the example of Denver. That happened to be a patient notification event that had 6,000 patients. Right now, I know many of you have probably heard of the multi-state patient notification event that that initially started out of New Hampshire. And that actually is somewhere around 10,000 patients at this point. So whenever you have a patient notification event of that size, that's really something that your healthcare facility is not going to be able to answer all the phone calls. And so we have even things in there of how to set up a call center and then overall risk communication guidance. And so these are some of the pieces. We're in the final stages of putting this together, but as we've compiled the materials, as facilities have been going through patient notification events, we've been giving them these materials in advance of it being fully available on our website. And so lastly, I just want to make you aware that we have a variety of resources out there for you. So some of the materials that I actually, and messages I talked about today, so some of those do's and don'ts, the model of trust and some of the concepts of risk communication are actually in this primer of health risk communication principles and practice, which is at this URL. So you can get this, use this as a very good key of kind of a nice workbook of when you're trying to figure out how to communicate on some of these difficult topics, looking at some of this in more detail. You can visit us online. So obviously we have a variety of websites, our Healthcare Associated Infection website, our NHSN website, we have a HICPAC website. We also have a blog. So our Safe Healthcare blog allows us to, we put all of our fact sheets and scientific information on our web, but our blog is an area where we actually can put information that explains in more detail what's going on. And then CDC, we also have an expert commentary series on Medscape. And so this is a great opportunity for us to get information out to clinicians. And so some of the examples here of the various scientists from Dr. Srinivasan and Dr. Gould and Dr. Jernigan are all examples of things that are on Medscape. So we have free CME on Medscape. We have video commentaries on many of the topics we talked about. And so lastly, just some takeaway points. Plan early and engage partners and build relationships before a crisis. Be transparent, communicate often, listen and be compassionate with your messaging. Include patient advocates, which are really your audience in your planning efforts. Focus on clear communication and learn from others of what has worked. So with that, I'd like to end even a little early. And thank you. And I'll be happy to take any questions that you may have.